Hello and welcome everyone. This is your host Scott with New Patients 365, and boy do we have an absolutely amazing webinar coming up. Before we introduce our instructor, I just want to have a look here. We have people logged in from Canada, Europe, the Middle East, the US, yep, and a real global audience today. Very exciting to see as always. Now, we know that your time is extremely valuable, and I know that Dr. El-Bialy himself has an important meeting right after this, so we're really going to try to keep things to under 45 minutes today. But boy, do we have a lot of info to pack into that 45 minutes. We will try to accommodate any questions you have, so if you have a question, please just type it into the message box below, and we will do our best to address it. But let's jump right in, and hold on 1 second, and I will now transfer over to Dr. El-Bialy. All right, Dr. El-Bialy, can you hear me okay?
Yeah.
Oh, perfect. Well, I will turn the slides over to you and let you go ahead. Thanks, Dr. El-Bialy.
Okay, thanks, Scott. Good afternoon, everybody, and I trust everybody has a wonderful week and looking for a nice weekend. So today I'll be sharing with you my experience on how to treat moderate to severe crowded cases almost in half of the time that we normally do with regular braces. So you are in the right place if you are currently struggling with some of your crowding cases, if IPR have issues, if you can't finish the cases, if you have never attempted to moderate to severe cases by Invisalign or align technology or clear aligners, and you would like to start, if you want to enhance your practice experience, and this is what I'm going to talk, and I'll walk you through it, my presentation. Also, if you want to enhance the profitability of your crowding cases, and I'll show you how this can be done in a few minutes. And also, if you want to learn the latest in cutting-edge technology and treatments, as well as, so it really doesn't matter where you are with moderate to severe cases at this moment, and we have something to help you with. So I work at University of Alberta as Associate Professor. I'm orthodontist, I'm bioengineer, and also I have an MBA. So all of those backgrounds have been amalgamated nicely into my private practice. So I apply the mechanics of orthodontics on using the clear aligners. And also, I look at my business from the profitability point of view and how clear aligners or Invisalign specifically had enhanced my practice profitability in the last few years. So here what you'll learn today by sticking around, why clear aligners are my number one choice for treating moderate to severe cases in my private practice. And also how you can use clear aligner to lessen the treatment time that takes to fix loose crowding cases with regular braces to up to 50% of the time. And then I'll summarize at the beginning, and then I'll summarize at the end the 3 steps that I use when I approach every crowding cases to ensure I get the perfect finish in the fastest time. And number one reason your current cases may not be treating out properly. And also I'll touch base on the science behind accelerated orthodontics and how to cut the treatment time and enhance patients' experience. So stick around at the end, and we have an amazing one-time offer for you, please. So I was like much everybody. I once treated most of my cases with Damon self-ligating brackets, headgear, pendulum, arch expansion appliances, Hyrex, pass, rapid palatal expansion appliances. The strange way I stumbled upon my current approach, mainly functional appliances and accelerated treatments. As everybody knows, everybody uses functional appliances now, and especially for class 2 skeletal growing cases, and some are using them for adults and adults. For me, maybe in the next few webinars, I'll cover class 2 mechanics for growing kids and for adults as well. And I'll show you cases that nobody ever thought those cases can be treated without surgery. And I finish this treatments between 9 months to 15 months in grown kids and also in late adolescents with amazing finishing, again, as I mentioned, between 9 months to 15 months treatments without extraction, without headgear, without surgery. But this will become in next few webinars when we start to talk about class 2 and class 3. But for today, I want to remain focused on crowding, moderate to severe crowded cases, and how I finish most of my cases in very short treatment time, especially in growing or adult patients. So I want to declare that I have no shares with Invisalign. I don't I have no conflict of interest with any clear aligner companies, including Invisalign. I'm just the user. I'm Elite, Invisalign Elite provider in Edmonton, Calgary, and Whitehorse. So the three main steps that I analyze most of my crowding cases are the patient age and profile. I look at the patient if it's growing or not growing. And in particularly for the profile, I look at the chin and the nose prominence relative to the lips, because in many cases you can finish the cases very fast if you expand and procline upper incisors. In the back, many years ago, extraction and retraction of the anterior teeth was like #1 in all orthodontic practices, and also with many general dentists that they get some hands-on with the orthodontics. However, right now, everything has been changed, I would say 180 degrees. Why? Because we noticed over the years that those extraction cases, they get older than where they are, or is sometimes older than their parents. Why? Because if someone has a prominent nose and chin, and you start to retract upper incisor backward, the chin and the nose will look more prominent and gives the aging face for these patients. So that's why it's extremely important that I look at the patient's age and profiles. Buccal corridor, which is the gap between the back teeth and the cheek. If there is a big back corridor, growing patients or non-growing patients, I expand. If there is any issues with the gum, especially periodontitis, gingival recession, then those patients will have to have periodontal consultation. Some of them might need grafts, bone grafts, or gingival grafts, no matter if you do expansion or not. So for those ones, these are the extremely important things that I consider when I analyze any crowded cases. So I want to stress today that my views and opinions here in this presentation are those of mine, and they don't reflect any other companies, including New Patients 365.com. Case examples presented here are for information purposes only, and no results are guaranteed because it depends on patients' compliance, the clinician experience, and all orthodontic analysis and treatments provided are the sole responsibility of the treating provider. So I'm going to start by identifying the limits where clear aligners can be used to treat orthodontic cases. I'll go from simple crowding cases to severe crowding cases. So this moderate crowding case, as you can see, this patient had about 6 to 7 millimeters of crowding in the upper, and about 6 to 7 also in the lower millimeters crowding anterior crossbite. And this patient, interestingly, her sibling sister was treated, or her sister had almost the same kind of amount of crowding, and she was treated in a different office by 4 premolar extraction. In contrast to this patient that I'll show you guys in 1 minute, the treatment that was done, her sister was treated for 2.5 years because of the extraction treatment. However, if you look carefully about this case, I want to show you this case. And she had a beautiful smile, but crowded teeth. However, also she had a buccal corridor here. So there is a big gap between the posterior teeth and her cheek when she had big smile. And also if you look carefully, she had the nose and the chin already prominent. This is late 20s female. So you need to consider when this patient will be in her 30s or 40s, what's going to happen to the chin and the nose? Normally they will get more prominence. So if you decide to do full premolar extraction for this patient, for example, what's going to happen? No matter how much you try to maintain the upper incisors with the R, if you try to move the posterior tooth forward, first of all, this treatment will take forever. If you do extraction and try to move the posterior teeth forward, and also patients will lose 4 premolars for no reason. So I decided to procline the upper and lower incisor and expand the upper arch. So imagine this case was finished in 9 months. And look at her nice lip support here. So if you go back, you can see her nose and chin were initially prominent. So now they are less prominent. And she even had more cheek prominence, which is really great. So this is the kind of case that anybody can treat, but you need to understand that this patient initially had a big buccal corridor here, and as I showed you in the profile, the nose and the chin were prominent. Extremely important that you need to notice that this patient had an asymmetric smile, so you can look at her nasolabial fold here. It's more pronounced than the right side, and that's why you can see her philtrum stretched away from the midline. However, if you look carefully about her nose, her facial midline is coincident with her dental midline. We maintain that, and she also maintained the asymmetric smile a little bit. So this is another challenging case. This 12 years old young lady. She had a perfect class 1 occlusion on the left side, midline are coincident, and class 1 on the right side, and this canine is ectopically erupted. That's how we used to say it before. And this patient had 2 other orthodontic consultation, and both orthodontic consultations provided her with 1 premolar extraction to extract 1/4 here. Why? Because everybody believed that because she had a perfect midline and class 1 here and class 1 here, so there is no need to, the only way to create space for this canine is to extract 1 premolar and get this canine down. However, looking at her buccal corridor as well, she had a narrow buccal corridor and she has a pretty straight profile. So extraction wouldn't help in this case. Same thing, torqued upper and lower incisors, expanded upper and lower buccal segments, get her canine in place, maintain the midline, as you can see, and the class 1 that she started with, and treatment was done in 1 year. You need to notice that on most of my cases, I have the patients change their aligners every week, and I always give them incentive that if they don't wear the aligners 20 hours a day, strictly 20 hours a day, then they will move from 1 week to 10 days, maybe 2 weeks, and this will take, the treatment will take forever, or at least double the treatment time. So, for example, if this patient gets about 30 or 40 aligners, so doing the math, if those kids or the patients are very compliant and following instructions and wear the aligners 20 hours a day, so at least 20 hours a day, what does it mean? It means that easily they can change the trays every week. And I have really no complaint at all about having the patient change their trays every week. And then I tell the patients, if you become lousy and lazy, so what's going to happen? You're going to change every 2 weeks. That means that instead of 1 year or about 11 months, that will take you to about 2 years. So most kids and most adults, they follow instructions, especially when I do the math for them. So this patient again was finished in 1 year. Now we're going to move to
Dr. El-Bialy.
Yes.
Sorry,
sir.
Dr. El-Bialy, we had a question. When you are speeding up and you are changing your aligners once a week, are you finding that you get more tracking issues when you're switching them out once a week?
Yeah, most of the time the tracking had no issues except if we do measure extrusions. So if we do measure extrusions, especially for the uppers and specifically for upper lateral incisors, normally I slow down a little bit, especially if the patient is not wearing the trace 20 hours, at least 20 hours a day. And in sometimes adult cases as well, sometimes I slow down to 10 days.
Okay, someone else asked that as well. If it was age dependent, if you had an older patient, would you still do once a week, or I think you just said you would go to 10 days?
Well, I go once a week for all of my patients, young, growing, or adults, as I mentioned, except in some specific cases for extrusion if the lateral incisors are really, really small. But in normal shape, and I'll show you a case towards the end that we finished in 7 months, even with extrusion of all incisors. So I also tell the patients some tricks about how to enhance the treatments or how to change the treatment, the aligners faster. I ask them to chew on the aligners. They don't have to use the chewies, but they can just chew on the aligners as if they're chewing gum. And normally I ask them to chew 10 times 10. So that's 10 chews. That makes 1 set. So I ask them to do 10 sets in the morning, in the afternoon, and in the evening. And what this would do, this would make, first of all, the plastic grasp the teeth and then makes the appropriate movement. That's number one. Number two, I discovered about 13 years ago that this similar plastic has what's called piezoelectric property. What's piezoelectric property is? Piezoelectric property is a property of a material, and I'm sure all orthodontists know about this because it's part of the traditional teaching orthodontics in residency, especially in bone growth. So piezoelectric property is a material. If when you tap on it or hit this material, some electric polarization happens around it, and this electric polarization basically is very important in bone remodeling. So when the patient bites on those plastic, they start to create these microcurrents around the trace, and those microcurrents can enhance bone remodeling and also tooth movement. So we have had lots of cases that we had no problem at all. We had X-rays, ICATs, like combined CTs taken for all of my patients, I would say most of them. Before and after, we had not seen any case with severe root resorption, adults or young grown kids with 1 week change. So I believe this plastic has this piezoelectric property which makes the teeth move faster, especially if the patient is chewing them. So that's an automatic accelerated tooth movement. So patients don't have to buy one of those new technology that they can cost between $1,200 to $1,500 of surgeries. Unless if there is a major bone deficiency, then bone or periodontal surgery and bone grafts are always needed. So let's go back to the severe crowding case. As you can see, this young fellow had insufficient space for the second premolar because early removal of the deciduous second molar here. And also, this canine here, basically, he lost the deciduous canine here. And then what happens, this permanent canine had no room at all to grow in. And this also led to shifting of the lower midline. As you can see, the lower midline shifted this way. So traditionally, in addition, you can see also there is lack of space here because of the early loss of the G and E here. So traditionally, a case like this could have been treated, and I'm sure thousands of similar cases are being treated now and used to be treated by what's called serial extraction. So you take out this first premolar, you take out this guy, so let the canine come in. Yeah, when you take out this one, the second premolar will come in. And same thing here, you take out the premolar here, so let the canine come in, and then you fit all the teeth So in addition, this guy also had bad oral hygiene, so we worked closely with him initially to control his oral hygiene. I offered him an expansion appliance, an active lingual arch, and active cut helix in the upper. Moved him to really expand the upper arch as much as I could. And as you can see here, I intentionally expand the upper premolar to the buccal crossbite limits because I know with Invisalign, with phase 2, it's easy to operate those guys by vertical elastics or regular braces if the patient chooses to go with regular braces. But if you look carefully here, after phase 1, just expanding the upper arch, you can see the second premolar that was totally blocked, now it's coming down, and the canine that was totally blocked here now start to come up. We need to consider also that we preserve the leeway space here as well. So with using the lingual arch or the active lingual arch, we managed to create some room for this growing canine, and also we maintained the leeway space that we're going to use later on. After 1 year of treatment with Invisalign, basically you can see all the teeth fit without extraction. All the upper arch is there. Canines erupted nicely. Class 1 midlines are centered. Solid class 1, and this is 1 year treatment. Now I'm going to talk about even more severe cases. So this young fellow, as you can see, had this canine sticking out, no much room for it, and also moderate crowding here in the lower, very deep overbite. But if you look carefully about this case, this is one of the things that I use tomogram or cone beam CT in all of my cases. The key here is if you have a patient with a buccal corridor, as you can see here, that gives you an idea there is a room for expansion. And I confirm that with the ICAT. You can look at the posterior teeth here. We have enough bone here buccal to the upper molar so we can expand those guys without any trouble. If you look at this patient's profile, he has a strong chin. This strong chin means, according to Bjork, that he is a forward grower. So we need to let this mandible to grow forward. How this mandible can grow forward with this deep overbite, there's no chance unless if you procline the upper incisors. And looking carefully at also the incision screen out of the cone beam CT, you can see the roots are here of this upper incisor are stuck with the labial surface of the bone labia here. So this tooth needs to be tipped. The crown needs to be tipped labially. This will give you improvement of the overbite, and also it will give you a room to let the mandible grow. One more bonus that we have had from the ICAT is that the tomogram showed that this condyle for this young fellow is way behind or situated back in the fossa. So this mandible needs to grow, but with this deep overbite, there is no way that this mandible can grow forwards. So an easy approach is to procline the upper incisors. So this will give you room to get this canine in, expand the upper arch, and you have enough bone, and then also procline the lower incisor. When you procline the upper incisor, not only this canine will come down and the overbite will be corrected, but also the mandible will have a room to grow forward and fix the patient convex profile, as you can see here. So 9 months into treatment, you can look at the patient profile has improved a lot, and also upper crowding was done by just proclining these guys and expanding the upper posterior segment, same thing in the lower. So imagine a 9 months treatment for this young fellow that traditionally he could have had 4 premolar extraction because of the crowding and the upper crowding as well, or headgear. So 9 months treatment again, and he is just in the finishing stage. And this is his twin brother. They're identical twin brother, but this is even more severe. You can see this canine is totally blocked, convex profile, again similar, deep overbite, and this tooth is totally blocked. Traditionally, we used to extract 4 premolars. Why? 1 premolar to get this canine in, the second premolar here in the top to fix the midline, and 2 premolars in the bottom to fix the crowding. However, imagine that's 15 months treatment. Look at his profile, has improved a lot, almost a straight profile, no functional appliance, no headgear, non-extraction treatment. And we are now working on torquing this lateral incisor that was initially trapped behind, in between the central incisor, like 4-1 and 3-1 and 3-3, and overbite has improved dramatically from 100% to 50%. Molar and canines are still class 1 because we are proclining the upper incisor and also we're letting the mandible grow forward. So this is another deep overbite case. As you can see, it's not only deep overbite but also class 2 end-to-end. And then in the future, we'll make a special webinar for class 2 only. And I'll show you how we can finish and treat cases by max protrusion, 11 millimeters of overjet, without extraction, without headgear, without functional appliance, solely by Invisalign or any clear aligner that might have the similar features like Invisalign. But anyways, so this young fellow, 12 years old, you can see end-to-end class 2, but this molar is class 1, and that's because this second deciduous molar was still there. So we utilize the E-space to maintain that molar where it is, and then use this space to move the canine backward and finish the patient in class 1 in 1 year treatment. Again, no extraction, no gear. He chose to have bonded retainer at the end of the treatment, although I offer most of my patients behavioral retainers because they come in 4 sets and very difficult for any kids to lose all 4 sets. Notice that I maintain the rotation of the second molar because I obtained first molar class 1 and canine class 1, and I know this rotation is going to relapse, so why bother by fixing the rotation if we can have a really nice intervegetation and the midlines are centered on the other side still class 1. So again, this is 1 year treatment. Now, I'm going to move and expand or stretch the envelope even more. So this is a skeletal class 3 boy. As you can see from his profile, anybody would see this profile would just think surgery, no matter how old the patient is. He's 16 years old and crowded anterior and anterior-crossbite, but his molars and canines are in class 1. So traditionally, again, if you see a case like this, especially from the patient profile, I would say 80% of the orthodontists would think about surgery, especially in 16 years old male. So chances this mandible will grow even more, it's there, the chance is there, and then this patient probably can have surgery later on. However, 1 year progress, you can see the anterior crossbite has improved a lot. We're still maintaining class 1, and again, you can see there's still a little bit of class 3 tendency, but again, class 1 here, and then we're still excluding the anteriors and leveling the curvus P here for the lower. But 1 year treatment in a case like this is really amazing. Now I'm going to talk about even surgical cases that was treated non-surgically. So this lady, she came and basically her concern that she has an anterior crossbite and posterior crossbite. Her dentist is doing Invisalign, and she wanted Invisalign, but he told her, no, you don't have, you are not a candidate for Invisalign. Why? Because he told her that you have a jaw shaft, and this jaw shaft needs an orthodontist that to coordinate your jaws with an oral surgeon to have jaw surgery. When she came and told me this story, I took very close eyes on her case, and I managed to finish her in 6 months without surgery, of course, without extraction, after she had an opinion with an orthodontist that offered her 2 years of orthodontic treatment with 4 premolar extraction and 2 jaw surgeries. So as you can see, this is the midline was centered. Initially, she had a midline shaft, as you can see here, and the jaw shaft, and 6 months treatment. We managed to fix the crossbite anterior and posterior. As you can see, this molar was rotated initially, and this molar was out of alignment with the second molar. That was an easy fix. And then, as you can see, this case was stable for 2 years after retention, and now she's on nighttime retention protocol. 6 months treatment in adults. Turn a surgical case to non-surgical case. I guess there is a huge thing. Again, there are lots of mechanics are involved, but they are easy mechanics that we use on daily basis with crossbite elastics and a pattern of how to utilize your aligners as well. Now, I'm going to switch gear to open bite cases. So open bite cases are always challenged in orthodontics. Why? As you can see, because of the tongue thrust. Fighting the tongue is always a lose battle unless if the tongue is trained to percute us. So this a young lady, 25 years old, female, she had an orthotic that opened her bites, and this orthotic because of orificial pain, and this orthotic basically positioned her jaw in this position, and she is absolutely happy with this position, but she's not happy, of course, with the open bite because she bites only on the second molar. Again, we managed to finish this case in 7 months. Treatments, as you can see, there are lots of extrusion mechanics here. And this, back to the question that was at the beginning, what can be tracking or not. If you look carefully about this case, the lateral incisor is quite wide and normal, normally actually in size and in harmony with the centrals and the canines. As you can see, this case, the lateral incisor, you can easily grab it with the Invisalign or any plastic trays. That's why extrusion was done in 7 months, and she has a beautiful smile. And now you just fine-tune things to justify our fees. Pre-prosthetic, this young lady, she has missing lateral incisors, and the canine was impacted here, and the mandible was, chin was prominent, class 3 facial type. However, and she was also told by another orthodontist that she requires 2 jaw surgeries and open space for implants. So we managed to finish her without surgery. As you can see, upper incisor get the normal inclination. We open spaces for implants, and now she had a vivera retainer with Pontics, and those Pontics are basically, we give the patient wax so they can fill in the Pontics so they don't hang around or move around with without false teeth around. So that's again, that's straightforward. So I'm going to talk about extraction. Of course, sometimes extraction can be done in some cases for one or any other reason. Although if this case was seen by me initially, I probably could have treated this case non-extraction. However, he had, as you can see here, he had 4 premolar were removed. He had a straight profile. I saw the case after extraction, but you can see 1 year in treatments, you can close all the gaps in 1 year treatments, and I managed to move all the posterior teeth forward with just Invisalign, and then after that, he was in a settling stage. You can see all the teeth were settled, and a really nice, solid, sucked in class 1 molar and the canines. And so a year of treatment and extraction in adults or late adolescents, I guess something that we can also discuss a lot more, utilizing elastics, vertical attachments, and try. I have to go back to this case for one reason, because if you look carefully, although this case has a really narrow arch to start with, and he could have benefit from expansion, I managed even after extraction to expand the upper arch. You can see the upper arch was expanded even with extraction. So using Invisalign, basically I was managed to not only to close the gaps that he had after the premolar extraction, but also expand to provide space for the tongue and the airway as well.
Sorry, Dr. El-Bialy, we had another question. How, when you're doing your expansion and proclination, what is your criteria for determining how much is safe, I guess, or how much expansion and proclination you can do?
Well, again, it's based on my ICAT or Combin CT. The Combin CT, I can see alveolar bone thickness, labial or buccal and lingual to the teeth. So this would give me, this is, I always say this is by GPS when I'm driving. When I do cases, I look at those cases from day one, and then I know if I have room to expand or not. Just relying on lateral spirometric and panoramic X-ray is not enough. So that's number one. Number two, I look at the nasolabial angle. If the patient has an obtuse or right nasolabial angle, the patient is still growing. That means that the nose is still going to grow more, and this patient will have a dished-in face later on. So I can procline the upper incisor without any issues. And interestingly, sometimes I show the patients their cases before and after this. Like this young lady that she was treated in 9 months. If you look carefully about her case, when we presented her case, she initially had a really sticking out nose. So at the end of the treatment, the 9 months treatment, she had a small nose. I didn't do any nose job or plastic for her, but just proclining the upper incisor give her a perception of small nose, which is really great. So again, the criteria for me: look the patient profile, the age, look at the nose and chin prominence, look at the buccal corridor, and most importantly, look at the prudential status if you don't have access to comb CT, because prudential status can give you an idea if there is room for expansion or not. However, with the new comb CTs that they are coming now in the market, especially this iCat Flex, and again, I don't have any shares with this company, but this iCat Flex, basically, it can provide a full scan, full 3D scan, computer tomography at the same amount of radiation of traditional panoramic X-ray. So basically, you are not adding more radiation, but you also get lots of information that can help you out diagnosing and treatment planning for your case. So again, this is not just a theory, it's a practice. And these are the same steps that I use in treating all of my crowding cases. This has changed my practice because now kids talk at school. Someone had braces for 2 years and still the orthodontist or the dentist told him, yeah, you still have another year ahead of you. And the other fellow next to him finishing 8, 9 months or a year treatment. And the guy with Invisalign or the girl with Invisalign takes her or his Invisalign at lunchtime. They eat what they eat, crunchy food, they eat popcorn. The other poor guy with braces sitting, looking jealous at them, can't eat any of those ones because he or she knows if they eat any crunchy food, then mom or dad will be mad at him and the orthodontist will be mad at him, and the treatment will take even longer. So imagine the difference. More importantly is that, excuse me, oral hygiene is absolutely better with any clear aligner or any removable appliances compared to fixed braces, no matter what kind of braces. So there are different studies in the literature. They said, yeah, those self-ligating brackets, they are more hygienic than traditional brackets, but all of them, all of the fixed braces, they have more inflammation. Patients, they have more inflammation in the gum compared to any removable appliance, including clear aligners. So I'm not sure why you showed up today. It may be because you are fed up with not getting the results you desire. Again, think about extraction and proclination. Okay, you're not changing unless if you start with a bimax protrusion. If you start with a bimax protrusion and you want to retract upper and lower incisors, that's an easy. We can easily also do it without extraction if you want to. Just expanding the upper arches, uprighting the upper and lower incisors, give them more torque. You can finish the case as if you treat the case with extraction. And if you absolutely have to extract, no other choice, you still can do extraction. And again, I showed you a extraction case that was finished in 1 year. Important, you need to know that in all fixed braces, no matter what kind technology you are using, if you use even preset cases like indirect bonding or those technology that they set up the cases for you, or Sure Smile or whatever. So you still have an error of bracket positioning. So no matter how precise the computers are, uh, kids, they break brackets. No matter what kind of glue you are using, what kind of separation you are using. So broken brackets always give you an error when you rebond them. And then you struggle for another 6 months to finish the case just because fixing of those bracket positioning errors. That's 6 months of fixing error that you already started with. And another 6-8 months to build your arch wires from lighter arch wire to heavier arch wires. Especially when we start to talk about class 2 and you want to use any class 2 elastics or heavier elastics or fixed functional lines. Those traditional ways, you cannot start class 2 correction, for example, until 7-8 months in treatment. When I come to the class 2 cases, I'll show you cases finished in 9 months. Just finished, not just going to start the fixed functional lines or the class 2 elastics that traditionally we do with braces. Now I finish cases, class 2 cases, late adolescent in 9 months. So basically, if you're afraid to get started, you need to look at the proven roadmap. The roadmap here, as I mentioned, CT, look at the cases carefully, clinically, profiles, buccal corridor. You may be just looking for a couple of tips, you're already successful treatment. Well, maybe, but these are the cases that I treat on daily basis, and I've shown you all those success. As Albert Einstein said, everything in life should be as simple as possible, but not simpler. So you need to think, and also make it easy for you and for your patients. So if there's one thing to take away today, I feel I have cracked the code on exact way you should be treating the majority of your crowding cases with aligners. I showed you simple and difficult and severe crowding cases. This system can save you a lot of time, money, and headaches. With broken brackets, patients call at the midnight or because you're close or weekends or you're away. So again, all of my patients, they are absolutely happy because they can see the treatments very fast. And again, this is a very replicable system proven by my success and the literature as well. So your next step, you can apply what you've learned today to start, or what do you think? You can fast track your success by joining me in a new training course that I'll be starting next week, and then I'll go over in details how you can set up your case. It's a very straightforward. I don't spend much time with my technician asking for 35 points how to set up my case. It's 2 or 3 lines and they know exactly what I'm looking for. So I'll walk you through all of the cases and the steps in the procedure, how I set my preferences so I don't spend much time with my technician or move the teeth one step at a time with the new CleanCheck Pro. This is absolutely fast, and trust me, it's the fastest way to get from point A to point B, because I always say using clear aligner, especially Invisalign in my hands, basically it's like me driving, flying with a jet from Edmonton to Vancouver. So it's 1 year, I don't have to go around the mountain. Using the braces, I can spend 16 hours driving and struggling around the mountain, and you don't know what surprises can come across the roads. Wildlife, a grizzly bear wants to hunt you, and some snow falls, so sometimes you can see nice scenes, yes, of course, but you need to imagine that there's also risk, and it's a long time. So we will have a special online training that you can apply right away, and with this online training, we can walk you through one of your cases. You can watch it, take some notes, you can apply it, but also sitting on your shoulder, you can have me like as if I'm sitting on your shoulder while I treat the cases. It's 1 hour training video with me. I'll walk you through everything step by step. I do, again, more details about initial case analysis, what the prescription steps in the CleanCheck, and also will provide a PDF of the slides. The step-by-step system documents, well, it's very easy and straightforward, but once you do it more than once, or you see your colleagues who do it together online, you'll have as if you have many residency online. And again, it's a very simple process to let you and your fellow drive and draw the map for your quick cases very quickly and effectively. And then I have no problem providing you with my clinical preferences. I'll show you the straightforward. There are about 10, 12 points, and they're straight, and I work with them all my time. It saves a lot of time and frustration, but you getting your cases set up correctly from the start. You don't have to wait, like go by trial and error and learn through the process, and it takes you many years. So the number one big bonus that I offer for the next training is the first doctor that will register for this one next coming training will receive a full clean check review for one of your cases. We'll go over details, what can be done, what cannot. You need to remember how much it costs. Obviously, could you charge a lot of this, but literally we have to be really realistic. You need to know that doctor time is about worth $700 per hour. And also, reduction in your treatment time is really worth more than that. In my case, in my private practice, I always offer our patient 10% discount upfront, and most of them they accept it because it's higher than any interest rate, higher discount than any interest rate that you can do with their Visa cards, regardless what kind of points you take. The clean check review normally, lots of other orthodontists they charge $25 to $500. My speaking fee, if I go for speaking, it starts at $1,000 per hour. However, this is what we decided. It's only $97 for the whole training, including one of your case, a complete analysis, and walk you through your clean check. And again, advanced crowding cases, the blueprints basically will walk you through your cases. And again, my personal guarantee is that if you're not 100% satisfied with this course, or if you left out without any understanding or any problems, you can bring with you also any of the questions that you might have or any challenging cases. And I'm sure everybody else will be benefit from. And again, if you are not 100% satisfied, your money will be guaranteed immediately. So the Advanced Crowding Case Blueprint course is available on April 3rd. Remember, PDF of all of the slides will be offered to the 10 registered dentists and orthodontists, step-by-step treatment guides, access to my personal clinical preferences. We'll offer this to the first 10 persons who will register in the next course. And again, we'll get the first 10 doctors will receive a complete clean check analysis for one of the cases. Just click on one of the links below, and then you can register, and then we'll see you soon. This is what's going to happen. You receive an email on April 3rd with instructions if you register for this coming course. You receive an email on April 3rd with instructions how to access the advanced crowding cases. You'll also receive all documents, PDF, and flowcharts on that date. If you are one of the first 10 doctors, I can send you my clean check review to review immediately. Sorry, you can send me your clean check to review immediately, and then I'll get back to you. So again, thank you very much for being with us today, and I'm looking forward to talk to you next week. Have a great Friday evening and great
Thank
weekend.
you, Dr. El-Bialy. And I know we had a bunch of questions here that people emailed in, and I know in the interest of time, I know you need to run, and we can't get to them all. But if I forward these questions on to you right now, would you be able to, is it okay if I tell people you'll respond to these questions that we didn't get to?
Absolutely. Send me an email with all of those questions, and I'll be more than happy to respond immediately.
All right, fantastic. Thank you very much again, Dr. El-Bialy, and we look forward to talking to you soon.
Okay, have a great weekend.
Thank you. Bye-bye.
Thank you. Bye-bye.